Okay, this video is going to be over neurodiagnostic test. So as a nurse, it is important that you understand some of the common neurological diagnostic tests, or at least be aware with what those tests are and what they are testing for when you are assessing patients that have a known or a potential neurological disorder. It is important for the nurse to know which tests may be used in order to indicate certain types of nervous system disorders, and again, just kind of know some of the pre-procedure, post-procedure nursing interventions and things like that that will need to go along with those neurological diagnostic tests. There is an outline for this lecture, and it will be posted in the lecture tab along with this video. Okay, so the first thing are just going to be some common blood tests or some laboratory tests that are done. Not a lot of labs specific are done for neurological tests. However, a lot of routine tests, just CBC, BMP, lab tests such as those may be done, and they may help actually narrow the diagnosis of a neurological disorder or maybe rule out a neurological disorder. But some that may be specific to neurological disorders are your ABGs or your arterial blood gas. Again, no specific or a certain test, but ABGs are done, of course, to measure oxygen or O2 and CO2 or carbon dioxide levels in the blood. And those may be altered with some neuro disorders. So specifically like Guillain-Barré syndrome affects their breathing patterns. So the patient's O2 and CO2 levels could be off. So you may see that done. Some urine tests may also be done. A urine culture may be done just to rule out an infection that may be related to a urinary tract, some type of sepsis. And of course, a lot of those, a UTI could lead to the patient having certain symptoms that might mimic or look like a neurological disease, but it could also lead to sepsis, and then that could lead to some neurological changes as well. And then urine drug screens are also performed to rule out drug use, or can also be done to identify certain drugs that may be are being used or abused, which could affect the person's neurological function. So not many specific lab tests, but those are a couple that may be performed. Okay, so some common actual diagnostic tests that are done. So the first one here is going to be what we refer to as the lumbar puncture. Sometimes you also hear the lumbar puncture referred to as a spinal tap, spinal puncture. You see that termed a few different things sometimes. But basically what happens with the lumbar puncture is it's the introduction of a hollow needle that has a stylet on the end of it, and that stylet is inserted into the lumbar subarachnoid space. And we have to make sure that strict aseptic technique is used during this procedure. Very, very important to decrease the risk of infection. So typically between L3 and L4 or L4 and L5 is typically that area where they will introduce that needle into that subarachnoid space. So there's basically three reasons that lumbar puncture can be performed. It can be done for therapeutic reasons. So maybe the patient needs to have some pus or some blood removed from that subarachnoid space, or it may have to be done to withdraw some cerebral spinal fluid in order to relieve pressure in that spinal cord in some instances. So it is contraindicated in patients that have increased intracranial pressure. And this is going to be a greatly increased intracranial pressure, which we'll talk about this later on, because withdrawal of that cerebral spinal fluid can actually cause a downward movement of a part of the brain, specifically that medulla oblongata. So that can cause brain herniation, and then that can actually lead to death. So we have to be very careful with that. A second reason is for administration of anesthesia, dyes, or medications. So you hear patients having lumbar punctures for that. And the third reason is diagnostic purposes. This is going to be usually done in patients who are experiencing neurological problems or actually have some signs and symptoms. So, for example, they can remove a small amount of cerebral spinal fluid for an exam, and then they can also measure the pressure of the cerebral spinal fluid. So typically that cerebral spinal fluid is placed into separate tubes. Usually one is to measure the blood cells. One is done to check for the protein and the glucose checks, and one is usually for like culture testing. So culture testing a lot of times is done to help diagnose bacterial or fungal meningitis, also herpes, encephalitis, some tumors, neurosyphilis, and then some other chronic central nervous system infections they can do those cultures for. And we'll talk a bit more again about the testing here in just a second. So it is a fairly common procedure. It is usually done in the patient's room at the bedside. Typically takes about 15 minutes, and there's usually no major dietary or fluid restrictions that are required prior to. So pre-procedure, so this is kind of what the nurse's role. So you as the nurse, pre-procedure lumbar puncture, you do want to make sure and have the patient to empty their bowel and their bladder. We want to decrease the chance of nicking that bowel or bladder with the puncture. Patient should also sign an informed consent. This is a required procedure for that. Proper positioning is very important in the lumbar puncture, so you want to help assist the patient for proper positioning. And normally this is going to be the fetal position where the knees are bent up to the chest. And you can kind of see that in the picture here on the screen. And this allows for full flexion of the spine and wider spaces between the vertebrae. They also may need to place a pillow between their legs in order to prevent the upper leg from rolling forward. And also a small pillow may be placed under the patient's head just to kind of help keep that spine in a more horizontal position. So if the patient is unable to tolerate this fetal position, you can have them sit up and extend their chest and their head toward their knees so they can actually kind of sit up kind of on the side of the bed if they cannot tolerate this position. But this is kind of that hallmark position that you do want to place the patient in. And it is important as far as patient teaching to explain to the patient, teach the patient that it's very important that they remain still and that they cooperate fully. Sometimes patients may actually require sedatives if they're very restless. You know, you're talking about the spinal cord. For some people, that may be hard for them to handle or just think about, and so they get really anxious for that. So they do have to sometimes sedate the patient or give some type of medication maybe prior to kind of help them relax. Okay, so during the procedure, the patient usually does have a local anesthetic that is inserted or that is used to numb the area of insertion. And then the physician will insert a needle into that subarachnoid space, again, at that L3, L4, or L4, L5 level. So in that inner space there. And you can see, again, you can see that on your screen there. It is important to provide support for the patient throughout the procedure. Usually the nurse kind of stands, facing the patient. Just they kind of help hold them in that position, but just kind of, give them support. You do want to also monitor neurological status and respiratory status during the procedure. And then usually, as far as patient teaching, you just want to explain to the patient that they may feel slight pain, but probably more pressure feeling than anything on insertion of that needle, because it's a fairly large needle. So a lot of times they do feel that pressure. If they feel sharp pain that shoots down one leg, then the needle may be close to a nerve. So again, just explaining to them that they should not experience anything like that, but some, just a little bit of slight pain or some pressure feeling at that insertion site is normal. And again, they are usually numbed, so hopefully that takes some of that pain away from that actual needle being inserted. Okay, so cerebral spinal fluid testing. So we'll talk about that here just a second. So these are some of the things that are tested with the cerebral spinal fluid. Again, that's one of the main reasons for doing the lumbar puncture is to gather that cerebral spinal fluid. So it can test the pressure. So it can test the pressure of that cerebral spinal fluid. There's actually just kind of like a little manometer that can actually be inserted there. And the pressure can be read. Typically, pressure, I'm not sure that your textbook gives a number, but somewhere between 60 and 180 is usually a pretty normal value for pressure, but you don't necessarily have to know that for any of these testing purposes for this. You do, however, want to be pretty familiar with the appearance and what the cerebrospinal fluid should look like. So again, usually it's about 3 tubes that they collect. So you do want to specifically look at the appearance of the cerebrospinal fluid. So the appearance should be clear and colorless. If blood is noted, then we usually suspect cerebral hemorrhage. So it should be clear and colorless. Any color usually indicates some type of abnormality. So we can pretty much assume that any color would indicate that something is wrong. Also, you want to look for the lymphocyte count. Typically, an elevated lymphocyte count may indicate that there's an infection. Could be a viral infection, could be indicate TB, meningitis, neurosyphilis. And typically, an elevated lymphocyte is evidenced by cloudy or turbid drainage. So turbid is more just another term for cloudy or opaque or a thick type drainage. So again, if you see that, that usually a lot of times indicates infection. Brown, orange, yellow appearance, that a lot of times indicates like an elevated protein level. Culture and sensitivity may also be done in order to find a causative organism of an infection. So if they have an infection, they may do the lumbar puncture just to check that culture and sensitivity. Again, also looking at protein. So increased protein may be evidenced by brown, orange, yellow drainage. This is usually indicative of a brain tumor, sometimes degenerative diseases such as multiple sclerosis, meningitis, encephalitis. Those can also have increased protein levels. And then we also are going to be looking at the glucose levels. And typically a decreased glucose is often a sign of acute meningitis. So increased could obviously indicate diabetes or something like that. But, typically, again, just we want a normal glucose level, but oftentimes reasons that oftentimes a lumbar puncture is done to diagnose meningitis. And so you will often see decreased levels with that, so of the glucose. All right, so post-procedure lumbar puncture. So once the procedure is over, it is going to be very important to explain to the patient that they must lie flat in bed for several hours. This can be, really just depends on the physician's orders and the patient's status, but maybe six hours up to 24 hours. So typically they are going to lie flat. Some doctors may even have the patient to lie prone with a pillow under their abdomen for the first hour in order to slow the leakage of that cerebrospinal fluid. And again, the reason they lie flat is we will have to ensure that the insertion site clots, and this is to decrease the risk of a post-lumbar headache, which we'll talk about here in just a second. So lying flat is very important post-procedure. Also, you want to be assessing the puncture site for any leakage. So you want to be sure to note any drainage that could be on their bandage. Also, you want to monitor for any swelling or redness at that puncture site. And post-lumbar headache. So I think about 40% of patients, so almost close to half of your patients who receive a lumbar puncture can have a common side effect, which is termed a post-lumbar headache. And this is just a headache, basically, that just happens once after the lumbar puncture is over. And what happens is this occurs because there is actual spinal fluid that is leaking into that dura mater. So it could be caused by puncture during the procedure or withdrawal of the needle. So different things can cause it. But again, it is a fairly common side effect. It can last several hours up to days after the procedure. And it can also start within hours, or it may even be up to 24 hours after the test that the post-lumbar headache could occur. But again, we try to lie them flat in order to help with that. So typically that headache is usually described as throbbing headache. It may be like a bifrontal or an occipital headache, usually worsens when sitting or standing. And then oftentimes the patient also has nausea and vomiting with this post-lumbar headache. So treatment for this usually is going to involve bed rest, a dark, quiet room. Analgesics, may help. Narcotics are typically just not helpful, or opioids. Ice packs to the head may help. Also, we want to increase their oral fluids or their IV fluid intake. If none of those have helped, the physician may perform what is referred to as a blood patch, and this is to kind of seal off that cerebral spinal fluid leak. And you can see that in your picture to the right there. So basically what happens with this is they take 20 to 30 milliliters of blood and they withdraw that from a large vein. And for example, that could come from the arm. And then they re-inject that back into the epidural space. And that's supposed to help provide a blood patch, or it kind of plugs the dura's puncture in order to stop that leakage. So that is something that can often be done as well if the post-lumbar headache continues and doesn't get any better. Okay, so some other diagnostic tests for neurological disorders, and most of these you guys will probably have heard of. So the CT scan or the CAT scan, we hear that term used as well, is used to detect pathological conditions of the cerebrum and the spinal cord. It can also detect intracranial bleeding, cerebral edema. It can show some infarctions, and you can see that on your outline. However, some cerebrovascular accidents or strokes may not show up for 3 to 4 days. So they may not always show up on CT. Hydrocephalus, and then some shifts in the brain structure. So those are also some things that the CT scan can be used to detect. These can be done with or without a contrast, and typically that indicates whether or not the patient is NPO or not. So they may or may not be NPO. If it's no contrast, there's usually not any prep, but if they do have contrast, they're usually NPO for that. You can fill in the blank there. You do want to assess for allergies to iodine or seafood, and hopefully you all remember that. So assess their allergy to iodine or seafood, or any contrast dyes, if they have any allergy to any contrast dyes, if the dye is being used. Okay, and I think the last bullet there you have on your outline is just that they may or may not be NPO. And again, that just depends on if they're using contrast or not. So typically 20 to 30 minutes, it takes a CAT scan 20 to 30 minutes to be performed without contrast, or could take up to an hour if they do have contrast. And again, it just kind of depends on what is being tested, or what actually the patient's being tested for, the reason that they're having it done. And you can see the picture of the CAT scan over to the far right of your screen. All right, the next test is a brain scan. Brain scans are probably used less frequently. I'm not sure how often these are even used now. But this is when they use radioactive isotopes and a scanner in order to detect pathological conditions of the cerebrum. So again, you can see there in your outline that it can detect diseases of the brain, such as tumors, brain abscesses, subdural hematomas, and then it also can be used to determine brain death. So they give them that IV radioactive isotope, and then it accumulates in the area of the disease. And you can see that in your picture on the screen there, where the colorful areas are on the screen. All right. The next one then is MRI. And the brain scan can take about 45 minutes to do. So not that that is really that important, but and there's typically no special prep for that as well. So the next one is the MRI, or magnetic resonance imaging. Again, a very common test that is done in order to identify some types of tissues and tumors and some vascular abnormalities. It is similar to the CT scan, but it gives more detailed 3D pictures. It is the most detailed image of soft tissues. So it can actually visualize blood flow. It can show occlusion of the cerebral arteries. Very useful in diagnosing cerebrovascular diseases. So it does use magnetic forces instead of contrast dye in order to view the body structure. So you have to be careful and remember that your patient can't have any metal, and we need to also assess for any allergies just due to the possible use of dye, but they typically don't use dye for MRI. and they can last a little while. They can take probably 45 minutes to an hour in order to complete the MRI. So the bottom left is going to show pictures, kind of what an MRI looks like. And so again, that's just going to give you more of the it just visualizes more structures than a CT scan, but of course takes longer, usually costs more. So, but the big thing there is no metal, so be sure to ask about that. And the last one listed here is the PET scan, or the PET scan, which stands for positron emission tomography scan. This is a newer test, although it's used quite often, but it's going to be similar to CT and MRI, but it does not show the structure and the blood flow to and from the organs like the CT and the MRI can. So, but for example, the area that's in question, which here likely is the brain, it is scanned, and then a color composite picture is obtained, and the levels of color indicates the glucose metabolism, which will help detect some disease states. So it kind of shows which areas are active versus non-active. So this is going to be your top left picture. Your bottom right picture is kind of your brain scan picture. So your PET scan is going to be your top left. All right. So usually discomfort is minimal. They do usually require IVs for the injection of a contrast. They actually use deoxyglucose with a radioactive fluorine. So we do need to check for allergies. The patient does have to lie still for a good little bit. It can take 45 minutes to an hour. And they usually are NPO at least 4 to 6 hours before this test. All right, some other common diagnostic tests. All right, so the EEG, or the electroencephalogram, is another pretty common test used in neurological disorders, which is a graphic record of electrical brain wave activity. So when we suspect certain issues with brain waves or brain activity, then they will oftentimes, you'll see an EEG performed. So again, it measures that electrical activity in the brain, or brain waves, which we sometimes call that. Typically, you can see in the picture there at the bottom left, it does involve placing 17 to 20 electrodes to the patient's scalp with an electrode paste, and they're usually either in a reclining or a supine position. You do need to make sure that the patient's hair and the scalp are clean before the test. Make sure they don't use any gels, lotions, or hairsprays. It's almost indicated for all patients who have any unexplained confusion. If the patient has any loss of consciousness, if they've had seizures for the first time, and then they'll often also do EEG to confirm brain death. Typically, there's no prep, except the patient may have to avoid Cokes, cola products that maybe contain caffeine, teas, morning coffee at the test, because those can actually stimulate an effect. Also, they usually withhold stimulants, antidepressants, tranquilizers, and any anticonvulsants 24 to 48 hours before, because again, they want to be able to see the full activity and not the activity with the medications. The patient does have to be really quiet during the procedure, so they should be asked to rest before and during the test, and to keep their movement minimal, because again, it's reading that electrical activity, and they have to be very still so that it doesn't pick up any abnormal just moving of the head or something. So it can take up to an hour, and then of course after the test, we usually just help the patient to wash their hair and kind of clean their hair up, because it's usually pretty sticky from the electrodes. Okay. Next, we are going to talk about an angiogram. Sorry, I forgot the myelogram. The myelogram is also, I was like, wait a minute, I'm missing one. So the myelogram is the next test, and the myelogram actually involves X-ray visualization of the spinal cord subarachnoid space after insertion of a radioactive dye into the subarachnoid space. So basically, they will move the patient into certain different various positions, and they take x-rays, and that way they can see, and you can see that at the top left there of that screen. So this is helpful in noting any obstructions within the spinal cord. So if they have like herniated or ruptured disc, any spinal tumors, they can see those on the myelogram. So pre-procedure, the patient is usually NPO at least 4 to 8 hours before. The patient's going to be positioned the same as with a lumbar puncture. Okay, they are, because they're going to actually basically do a lumbar puncture while they're doing the myelogram. It can take about 2 hours. You do want to explain to the patient they maybe have some slight discomfort. Also, it's important to obtain the patient's baseline lower extremity strength and sensation, just to make sure to compare afterwards, to make sure that nothing was accidentally nicked or any nerves or things involved. And be sure to check the patient's history of any reaction to iodine or other dyes. Now, during the procedure, they're going to first remove approximately 10 milliliters of cerebral spinal fluid, and then they're going to insert the dye to observe for flow of that through the spinal canal. And again, they're going to take the x-rays. So the dye that they use, they have used oil-based and water-based in the past. So oil-based is actually not absorbed and has to be removed after the procedure. So most often what you see used is the water-based, because it can be absorbed and it's excreted in the kidneys. So that's usually the most common dye that's used, is your absorbable dyes. So again, the patient may be asked to move to different positions so that the spinal canal can be visualized while that fluoroscopic and radiopaque films are taken. So after the procedure is over, the patient may complain of a headache. This is common, but any complaints of any neck stiffness and pain should be reported, because that could actually indicate meningeal irritation. So we do want to be sure to report that. The care basically is going to just depend on the type of contrast that's used. Again, since mostly water-based is used, that's what we'll talk about. So they should be on bed rest. Head of the bed can be elevated 30 to 60 degrees for the first 24 hours. That's to help prevent seizures and also to decrease the chance that the dye may go into the cerebral spinal fluid, because the dye can actually disperse upward. So if it enters the cranial vault, then that could cause seizures. So again, we want to kind of elevate the head of the bed a little bit, whereas with a lumbar puncture, they stay flat because we're trying to decrease that risk of leakage of that cerebral spinal fluid at that puncture site. But with a myelogram, we actually have put dye into the spinal cord. So that patient needs to sit up so that it doesn't enter that cerebral area or the cranium. If they are, having headaches, we might have them lie flat. But again, in order just to decrease headache, but we do want to try to elevate that head the first 24 hours. But again, typically those headaches occur, that's going to occur later, more later than sooner, typically with the headache. But that first 24 hours, they need to elevate the head of the bed, and then after that time, they can lie flat in order to decrease the risk of headache. Also, you want to monitor vital signs, monitor the patient's ability to void and that sensation and their strength of their lower extremities. You can also encourage fluids in order to help rid that body of the dye. And a regular diet and activity are usually resumed or assumed the day after, as long as there's no complications. Okay, so now we'll move forward to the angiogram, or the cerebral angiography, sometimes it's referred to that. And this test is used to visualize circulation of the blood in the brain. This involves injection of a contrast agent through the femoral artery in order to visualize the cerebral arteries. And you can see that the top right picture. This is used in order to diagnose arterial aneurysms, vessel defects, ruptured vessels, displaced vessels by tumors or masses, and also it's useful to determine causes of strokes, headaches, or seizures. So again, they're going to do that angiogram to try to visualize the circulation of that blood in the brain. Before the procedure, so the preparation, they should be NPO at least 6 to 10 hours before the procedure, or be on clear liquid.